The Brazilian Society of Cardiology doesn't trust anyone else but you. Whether you're using the manual technique or these devices that do automatic checks, the bill has arrived. Many professionals, when checking blood pressure, didn't use the stethoscope because they said their finger could predict it, right? By looking at the gauge on the manometer, the systolic pressure and what happens, that's not allowed. That's not the palpatory technique. The palpatory technique is done on the radial artery, not the brachial. They confuse the techniques, they do it wrong, or they learned it wrong, or they learned it right and do it wrong, and now the consequences have arrived. I'm going to read what the Brazilian Society of Cardiology, at its 80th Congress, which took place recently in September in Sao Paulo, highlighted about blood pressure measurement. With automatic or semi-automatic sphygmomanometers using the oscillometric technique, they offer an advantage over the auscultatory technique with a reduction in errors caused by the observer and greater ease in performing the procedure. In other words, this device is more reliable than most professionals who check blood pressure. And I said, stop checking blood pressure, it's wrong. Everyone here does it. Everyone here does it. Well, now it's lost credibility. Is an oscillometric device more reliable than you who studied to do this and does it wrong? Because they claim that this causes otitis, that it hurts the ear, that I don't know what, but they love to put a little stethoscope around their neck to take a picture. That's right. Now you'll check blood pressure on this device. You'll need to study to do it, just like those who haven't. Does that work for you, my friends? Well, folks, we need to have knowledge. We need to bring back what is good. Now, you also need to master the medications because if not, in a few days, what's going to happen is that we won't need professionals anymore if you start doing things carelessly. And I will offer on October 7th, 8th, and 9th, the 6th week of good practices in medication administration in emergencies. If you want to participate and learn for free, you need to sign up, put your average here, join in. It's going to be amazing. You'll learn a lot. Everything is updated according to the Brazilian Society of Cardiology, meaning the Brazilian medications that we have available for us to use here. All right, I'm waiting for you. October 7th, 8th, and 9th. It will be live, free, and with no replay. If you don't show up, you miss out.